Hello everyone, I'm back here again. My name is Dr. Manish Yadav. I'm a homeopathic consultant from Mumbai. In the series of understanding Burnett's approach, today I have come up with a very important case. In fact, this case is such a case, I can tell you, if you really understand this case, the way Burnette approached it, it can give us a lot of ideas into the thinking process of how did Burnette approach, what was his understanding. So the chapter number 26, we're going to talk about in Tumor's Breast, the book. He talks about a case of tumor breast. There's a tumor. A lady comes to her and we'll see the case, how he thinks, how he changes the remedy, and try to explore his mental understanding, his approach basically. Of course, there are a few things which I'm going to talk about is from my understanding, how I understood Burnette. But of course, a lot of things are given in his literatures. If an ardent student really works hard and reads his literature properly and works out in his patients, definitely he'll also get a glimpse of. So let's go on this journey and try and understand his approach in especially deep pathological cases. What was his thinking process behind giving remedies and changing remedies, and how did he thought about it? So I'm going to go directly to the case. Chapter number 8. Chapter number 8, when you go, tumor of left breast. A patient comes to her with tumor of left breast. Let's see her approach. First, I'll read the case note. On April 16th, 1888, Mrs. X, a young widow, 26 years of age, mother of 2 children, both of women have, however, died, came telling me she had been under treatment St. Thomas Hospital, Elswell, for a tumor of breast. So this lady comes to Dr. Burnette, 26 years of lady, and she had 2 children, both of them died. After that, she comes to going into the analysis and the past history, how it started. Menses regular but painful. Tumor is more painful at the monthly time. She had a knock on her left breast 15 months ago. Knock in the sense, maybe she had fallen down, something hit on her breast, something happened, some physical injury happened. Hospital surgeons, of course, they advised for operation. In the outer aspect of left breast, I found a very painful swelling. The corresponding part of the right breast being also tender to touch, but not the seat of any tumor. Patient was of opinion that tumor in the left breast was a trifle smaller than it had been, but more painful, much more painful. The first 2 very obvious points in this case were much grief. So, of course, if a normal student like us, if I ask you what was the main cause or main symptom here, of course, there was a grief. A young woman, fancy young woman of delicate health who had lost her 2 babies and even husband also, who had been recommended by half a dozen surgeons to repute to one of the breast ablated. Then there was probably some blow. In fact, she dated the whole thing to blow. So what Burnette tries to say is that grief is there, definitely. If somebody loses 2 children's, husband, there's a lot of grief inside. Definitely it is there. It could be one of the causes. It could be one of the maybe exciting cause of the disease. But there was one more cause, which was blow on the breast. And she says, she dated the whole thing to a blow. Means she says that, I think, doctor, after that injury, after that fall or hit on my breast, physical injury, I started feeling some changes in my breast. So here we see 2 causes, definitely. Of course, our idea would be to find a remedy which has both the things, a blow, an injury, and maybe the grief. That's how generally a homeopath will think. But let us see how Burnette thinks about it. Past history. As I've spoken to you, and I would urge to all my friends who are listening to me, before watching this video, or even if you complete this video, if you really want to understand how Burnette was thinking, you should go and see my introductory videos where I am being talking about seat of action, range of action, and the kind of action. Past history and family history, especially, are very important component. And I have told this many times in my talks that where Hahnemann stopped, actually Burnette started. Hahnemann gave a lot of importance in his later life. He gave a lot of importance to miasms. To understand miasm, it is very important to go back and understand this, the seed from where the soil is coming. So past history, you cannot rule out. You have to go back and understand. And you'll find out in your cases also that there are many aspects, many layers to it. Past history of anorexia, anemia, twice she was vaccinated, measles, a weak chest, pneumonia, bronchitis. She suffered from pneumonia, bronchitis, chest was weak due to the illness, low fever, she used to keep getting, of course, the blow, and much grief. The two later part, 7th and 8th point, we of course spoke about. Now, people will ask why to go back and look for all the past histories. The past histories are going to give you the indications of your intercurrents. I will talk about the intercurrents, when to give the intercurrents, and how should we give intercurrents. So keep this in mind. If you can take a screenshot of this, maybe in your mobile, and we'll talk about it later. So now let's go ahead. Approach. Let's talk about the approach. So you got the data, you got the cause, you got the past history. Now let's see what happens. How is he thinking? First thing is cause. He will always try to find out the cause. And cause lies in the past history and the families. Just like that, a disease cannot fall. Of course, you know that. A disease cannot come like this, right? How many people, how many females get a blow on the breast? They fall down, something falls on them, injury happens, some beating happens, fights happen. Does everybody get a tumor? Then why she got it? Or why specific patient gets it after a blow, tumor comes in? Why? That's a question you have to ask yourself. Then you will get your answers, basically. So we have to treat that. But yes, why? Why? The answer of why lies in past history and family history. That's what we call the soil. The soil on which the constitution is being, the physical and the mental constitution is being erupted. That soil has to be treated. Second point, after cause, he will always focus on present predominant symptom, PPT, present predominant symptom. So in his many of his cases, you'll find out that there are subsequent frequent changes of medicines. Of course, it's very hard to understand why he gave the medicines because indications are not given everywhere. But probably we can understand out of his learning, out of his literature, is that present predominant symptoms. You treat the present predominant symptom. What is the present suffering with the remedies? It may be minimum indications. Those are maybe superficial remedies, you can call them. But you treat them, you address them. What has come up front. We always want a repertory sheet for the answer, then for the indications. But let me tell you, these people, all these pioneers, Burnette, Clark, everybody, all the pioneers, Farrington, they all were materia medica masters. Burnette used to read pharmacodynamics from Hughes. A lot of his literary works was from Hughes. And that's what you can find out. You can see that when we come to the potency selection, you'll see that he used to give a lot of low potencies because from that mindset he was there. But yes, potency we can discuss later, but that's how it is. So many places you'll see that small remedies he's using it. And the only thing is he wants to treat that present predominant totality with the pathology, what is involved, considering that. And of course, his materia medica knowledge. Many times he tries and tests his remedies also. And of course, the third thing, which is very important in Burnett's approach, is organopathy. Somewhere, I forgot where, but in that book, somewhere it is written, a homeopath, a clinician, has to be a very good pathologist. In fact, if you're very good, your pathology is very good, and you can understand the anatomy, the pathology, the physiology, you can understand, like a patient comes to you with a lot of gastritis. We can give Nux Vomica, Robinia, XYZ. But if you know, okay, if you look at the reports and you know gallbladder is affected, you know, okay, sluggish liver is there. Okay, there could be some portal vein, portal system, problem. So patient comes with a piles or, sluggish circulation. The organs, it's like, I feel it like you are a homeopath outside, but inside you are an allopath. And it really helps if you see Boric, if you see other people like them. They always thought about they never neglected the organs. Which organ is affected? Which organ is affected? And somehow our system of learning, homeopaths have got drifted away from this. I'm not saying that advanced methods are not great. They should not learn from them. You should learn, but you have to draw a line between some time where too much theorization, too much, unnecessary data is being asked. You have to be aware of too much theorization, and you have to focus on facts. If you focus on facts and connect it with Materia Medica, you can really help a lot of patients, a lot of suffering patients. So this is the actual approach that he looks at, okay, in his patients. Let us try and understand one by one. So what was his first? The patient came to him. What was his first symptom? It was the grief. Of course, somebody loses 2 children and husband, 26 years, such a young age. What do you expect? So grief is predominant. So one exciting cause is grief also. It's not the main cause though, but it's an exciting cause. So one is the grief, okay? And the emotions, the mental emotions, they play a big role in exciting your diseases, even causing your diseases. So you have to address it. So the first remedy that he gives, we all came to the same remedy, is Ignatia. 1x. Forget the potency. You take care of the potency with whatever understanding you have. Forget the potency. If you ask me what I would have given a potency here, more of emotions and psychological things are there, mental symptoms are more, I would have given 1m or 10m. This is my understanding, okay? But along with grief, there was one more thing which was the exciting cause or the maintaining cause, not the maintaining cause, but especially the exciting cause, or maybe the real cause. You should say it exciting cause, the blow. Now you have to think which are the remedies that we have that after a blow, cancer comes in. So there are many remedies, not much remedies. There are few remedies. And one of them, which is being extensively used by Burnette, is Bellis perennis. Please go and read Bellis perennis, deep tissue organ. When there is an injury to deep tissue organ and then tumor forms, it gets affected. Bellis perennis is an amazing remedy. Traumatism. It's an internal deep traumatism, deep organ trauma. Bellisper is a wonderful drug. Please read that. It will be of great help when your simple arnica, ruta, and all these remedies fail. Okay. Now let us see what happens. May 16, the patient is brighter, better in herself. Tumor is very painful and more defined. So there are some changes. Isn't that good? I always feel happy when I give the medicine and there are some changes happening in the patient. Maybe good or bad, but something happens. It says whenever this happens, it is definite. It is definite that your medicine is acted. So now tumor is painful, more painful, aggravated maybe, but it has become more defined. Earlier it was, like spreading. Now he gives puja. As I said, forget the potential. I'll be talking about potential later. 30. He gives Tuja. Now, why Tuja? This is what we have to understand. Now, here he uses Tuja as an intercurrent drug, as a miasmatic drug. Psychosis in the background. Why psychosis? Okay, let me go back and show you this. I will come to the slide again and again. If you see this now as we are, I'm telling you beforehand so that you understand it easy. As we go and see in the follow-ups, what is he going to do is that he is going to treat, he's going to address all these causes as far as he can do it. So for blow, he had given Belisper, much grief, Ignatia, weak chest bronchitis, measles, twice vaccinated, anemia, anorexia, and all those things, low fever. He will address it through intercurrent drugs. And I'll also tell you how to give intercurrents. Understanding Burnette, I realized that giving intercurrent, generally intercurrent should be given, of course, well-selected remedies fail to act and all those things are there. But generally in intercurrents, how it has to be used is when you have given a remedy and there is a status quo, generally. There's a status quo. There are not much changes happening. There are not much exciting things happening. Patient is not excited. Pains are not there. Other modalities and symptoms are not there. It is status quo. That is the best time to introduce your nosol. That's the best time, actually. So you'll see in the follow-up, twice she was vaccinated. And according to Burnette, vaccines are one of the most important causes of diseases. One of the most dangerous ones. All homeopaths, generally agree with it. So he says, which is the biggest monster is the vaccine. And she was twice vaccinated. So remove the cause by giving Tujan. And psychotic element like anemia. Anemia is also, Alan writes down that Alan's miasm, he says anemia is a very important symptom of psychosis. June 13, she comes, better in health, very bilious and many headaches. Now see what's happening. After giving your nosol, some changes will happen. Some symptoms will erupt. Some organs will get excited. And then you shift your focus on those symptoms, those organs, and give an appropriate remedy. So patient says, generally I'm better, but my bilious, I've become very bilious. Means the bile is being affected. The gallbladder is being affected. She's getting the bilious, all the biles are coming. And because of that, lot of headaches. Here he gives Sorinum. Why Sorinum? Generally, why Sorinum? There could be many reasons. What I understood is that psoric plus liver affected and headache. Why psoric? Now you'll say, hey, it was psychotic. You said now psoric. Every case is psoric. When you read Allen's miasm, Hahnemann's miasm, the beating ground, the base of all the diseases is Sora. Sora is the monster. So ultimately, somewhere or the other, you will have to intervene with intersorics. Anti-miasmatic, whenever you're talking about, you give your psychosis, you treat your syphilis, everything, but Sora always remain in the background. And whenever symptoms erupt, psoric things are there, of course, Sorinum, Sora should be thought of it. This is my understanding that psoric symptoms, liver affected, so which are the liver remedies and headache. You can agree with this, you cannot agree with it. That's okay. What can you learn from this, or I learn from it? I don't agree with Sorinum right here, but if this patient comes to me, what I will do is that I will properly repertorize. I will look for the organ affinity. This is present predominant symptom. Now, where are we? We are working on present predominant symptom. Patient has come with discomfort, some acute symptoms it has come. So I will manage it with my understanding of Mater Medica, repertorization. Maybe Sorinum, a lot of other indications would have been there, like hungry, chilliness, okay, never well since. So you can repertorize and treat it as an acute, okay. But learning point is here, even in present predominant totality also, he is trying to understand which organ is affected. So liver is affected. So he will try to find out liver remedies and headache. Which are the remedies where liver is affected and headache is affected? Now here your Mater Medica understanding comes into picture. But yes, you can repertorize and then read from Mater Medica and differentiate the remedy. Now what happens next? At first the lump swelled a good deal, then went down. It is not welled, it is swelled. Okay. It grew good deal, then it went down again. Patient is very yellow, bilious, and tumor is very tender. You can see this. Patient is yellow and bilious, and tumor is tender. So one side tumor is there, but what is behind? What is inside? Which organs are affected? Actually, she is bilious. The liver is affected. The gallbladder liver is affected. So the remedies that you're going to think of, it has to have liver affinity, probably. Okay. Now here what he does is that he gives hydrastis. Of course, you know hydrastis in a local form. We use it in a mother tincture form. And biliousness, tumor, hydrastis is a very good remedy. Also, one thing about hydrastis which I have understood is that it's written in hydrastis, in tuberculinum, Allen's keynote, to fatten tubercular children, you should give hydrastis. To fatten tubercular children, you should give hydrastis. So if you have a tubercular child, a child comes to you and he's talking about, mother is saying he doesn't eat, he's eating too much, but he's not gaining weight. You can start with hydrastis. It will give little bulk. So what we learn from this is hydrastis is basically has some connection with tuberculosis or tubercular diathesis, basically. And if you look at this patient, she was affected with bronchitis, pneumonia. And whenever pneumonia, bronchitis, and all those things, the lungs are affected, your tubercular diathesis is also very prominent. It's a mixed miasmatic case. So basilinum, you can think of basilinum, which is going to come in the next one. So in that way, here you can find out this prescription is actually organ specific, totally organ specific. So liver, seat of action. Earlier he gave sorinum, little better, not better, whatever. But now biliousness is increasing. So now he thinks organopathically, completely Rademacher approach. He thinks which is an organ remedy I can give directly. And whenever you give an organ remedy, your approach is organopathic. That is a time when you think about mother tinctures. Mother tinctures should be given only when your thinking process is completely pathology. You want to address an organ, not the symptoms. But yes, it should not be given. There's no specificity. You have to individualize even in giving organ remedies like mother tinctures. How do you individualize? You please go and read Boric. There are a lot of symptoms written in Boric, especially in bold and italics. But something written there has to match with the patient. And if it matches, your even mother tinctures can do great relief to the patients. That's how you should approach and study mother tinctures. Next, she comes, she does not think there is any real improvement. Does this happen with you? It happens with me a lot. Patients, so much we are trying, and then follow-up patient comes and says, oh, I think doctor, things are status quo. As I was, I am staying there. This is a real follow-up. This is a real. Now what to do? He gives ferrum picricum. There's another remedy, ferrum picricum. Why he gives ferrum picricum? Boric, if you read, headache, biliousness, sensitive liver, psychotic, liver medicine, bright looking. So all those things when you combine, ferrum picricum is one of the remedies that comes up. So again, you see, he's again thinking of, okay, psychosis in the background, liver is there, headache is there. His sorinum worked partially, maybe. He gave hydrastis. It also helped a little bit. And then he thinks about another remedy. This was the reason why he was always changing it. But yes, if you read it properly, repetize and give it properly, maybe if the patient's follow-up is good, there's no need to keep changing the remedies. Okay? Ferrum, these are certain symptoms, when we think of ferrum is false plethora and pseudo-leukemia. So false plethora, okay? HB maybe is good, but this is maybe HB is low, but plethora is there or some kind of thing, no? False. It doesn't, the symptoms don't match with the blood counts. Congestion happens, redness happens. So don't just give because headache, biliousness, psychotic, liver medicine, give therapeutic. What I would suggest is that this understanding I am giving from my side. Of course, Burnett wouldn't have done this. He would have seen the characteristic and he was knowing the remedy in depth. That's why he was prescribing. For us, when you treat present predominant totality, please read bold and italics and match it. Here we are learning the approach nearly well, but she suffers fearfully from neuralgia of jaw. So now what happens? Her liver is now settled after so many changes of remedies. Her liver is now settled. But what comes in? Neuralgia of jaw comes in. Doesn't it happen? When I used to see cases of people, I used to wonder many times that, a patient came with bad pathology and one remedy was given and then patient got better. It looks like miracle. When I started my practice, it was very hard for me to get the same result because as I'm treating it, somehow something in the between comes up. Some other thing comes up. And I used to wonder, what should I do? And there were a lot of philosophies, a lot of teachers who used to say that don't touch that, don't treat that. He can take allopathy, that's okay, but don't treat it. But that's not the case. That's not the case. Every symptom that is vital force is throwing is a way to cure. Vital force is saying, please treat this, I will get much better. Please treat this, I will get much better. That is why change of remedies are big. Now here what he does, very nicely, he gives Basilinum. Of course, you can take the totality of neuralgia and all. You can think so many remedies, xanthozylum and so many other beautiful remedies are there if the bold and the italics matches. But generally, many times a patient comes with maybe, like suppose in this case, neuralgia. That's just neuralgia. There are no modalities. There are no ailments. There are no other characteristic symptoms to prescribe. So he goes in the back. Miasmatic. Now he's thinking, okay, I have to also address the soil. I'm treating the offshoots, but the source of all the disease is actually in the past history, the soil, the miasm. So I annihilated Thuja with Thuja psychotic, the vaccines that were given. He had got pneumonia. He got bronchitis. He has weak chest. So tubercular diathesis is also very prominent. And Basilinum was proved by him. He used Basilinum a lot. There are wonderful results with Basilinum. He gives Basilinum to address the cause. This is wonderful. Because generally, I would have thought about giving neuralgic remedy. Maybe if indications are not there, I would have given that. But what is he thinking? This is actually he's thinking about, he knows, actually Burnett was really knowing what Hahnemann actually said in his last. Hahnemann always said, Rima Handley's book, I have told it many times in my talks, Rima Handley's last letter of Hahnemann, last letters of Hahnemann's life, Rima Handley. You should read that book. You'll find there many places where present predominant totality was there, but Hahnemann said no to that. No prescription based on that. He always looked in the back and kept on prescribing anti-miasmatic, and patient got better. So that's a different approach altogether. No sort layer. So what is he addressing? Now understand this point very, very nicely. So one side, we are treating the present totality. We give remedy, patient goes, then comes back. We give remedy, patient goes, then comes back. Sometimes you have to halt and think, and every time I'm giving the remedy and patient is coming back, why is he coming back? Because maybe you are treating the offshoots of the disease, not the real disease. The source of the disease is the miasm, is in the background, is in the past history. You have to hit that thing to get these offshoots. These are tentacles coming out. You're trying to remove one tentacle, but you have to go to the source of the tentacles, the branches. You're trying to, cut the branches. One branch comes up, one symptom, one totality, you kill it. Another branch comes, you kill it with the medicine. But look at the root. Where is the root? Okay. Very bad bilious text, very bad bilious attack, and tumor has increased in size somewhat. Don't get scared. Generally now, when you give anti-miasmatic, something has to happen. Either, if it is actually correct, I feel something has to happen. And majority of time, there's an aggravation. So don't worry about that. You should be actually happy if after giving anti-miasmatic drug, intercurrent or no-so drug, aggravation happens. That's a really, really good thing. So what he does not worry. He says bad biliousness, let's give some organ remedy, and he gives hydroxysteroid. So why he gave hydroxysteroid? Liver and organopathic drug, which is very simple. Tumor is now nearly gone. Amazing, right? So now what happens? Tumor is nearly gone. She says, and I have difficulty in finding its remnant. She's pale and bilious. Again, you can see pale and bilious. He gives rubia tinctura. If you read rubia tinctura, it's again a remedy for biliousness. Forget about rubia tinctura. You take present totality and you treat. Next, what happens? A little bit of tumor that remains is now more evident by pain than bulk. Means the bulk of the tumor is gone. She's settled, no problem. But again, little bit, the remnant that is remaining, that starts little bit paining. What he does, I'll take you back to the past system. What he does. Look at this. He's trying to remove all these layers one by one. So psychotic, anorexia, anemia, low fevers, comes in psychosis. Why Thuja he addressed it. Low Pelisper he addressed. Ignatia, layer of grief went out. Twice vaccinated, Thuja, psychotic, taken care. Pneumonia, Bacillinum, intercurrently given. So what is left? Measles. Now he will target to hit this measles. Give an intercurrent which can target this measles. You can ask, measles is just a viral disease. Yeah, it is a viral disease, but every disease which comes and hits, there is a probability, there is a possibility that its virulence, some of its virulence attaches to the vital force it affects when it passes on. That is why we have got remedies, never well since typhoid, never well since pneumonia, never well since blood loss. What is that? Never well since measles. What is that? Never well since surgery. Any trauma, any affection that happens on the vital force, the disease can go, but its imprint, yeah, the right word is imprint. Imprint remains. This imprint is there in the soil, and this is actually causing the disease. So he is trying in his follow-up, one by one, to remove all the imprints, and at the same time, so he's removing one side the imprints, the Thuja, Bacillinum, and all those things, and other side he's trying to always look for the present totality and give the remedy, maybe the symptoms, location, sensation, modality, or look for the organ which is affected, give organ remedy. Now here he gives morbillion. Again a nosode, again an intercurrent, to go back and remove that imprint, that one imprint which was remaining. Measles, right? Pain is nearly gone, but she will have it, that tumor has grown again later. So pain is gone, but little tumor grown again. Don't worry about that. He repeats measles again, like morbillium again. Tumor is quite gone. Patient is still pale and there is still little pyrodynia. Now here he gives supina. This is something very interesting. He gives supina. Psychosis. He's addressing the psychosis. Out of all the miasms, if you see in this case, predominant miasm is psychosis. Of course, tuberculosis you can see. Of course, the measles layer you can see. You have addressed it. But predominantly, of course, Sora is always in the background. But predominantly, if you see, psychosis is actually there. The tumor is there. Vaccinated 2 times is there. Anemia is there. Low grade fever is there. Anorexia is there. Psychosis is there. So he wants to address this psychotic disease again. Out of all the diseases now, of course, the dangerous one is the Sora. But out of all these 3 diseases, the nosodes that we talk about, the miasm, Sora, psychosis, and syphilis, psychosis is the one which actually takes time. and it has to be addressed properly. And intercurrently, you have to keep giving intercurrent remedies as the patient goes ahead. But the question here comes that why he gave Sabina? He should have given Tuja, right? He should have given Tuja. But he gave Sabina. What happened? This ended the matter. Patient continues well and has no way, no tumor, and St. Thomas prognosis notwithstanding. Like they said, for operation, short term. Basic question is why Sabina? For me, I understood all the things, but my question was why Sabina? I could have given Tuja because I understand now the intercurrent process, but why Sabina? Why Sabina? Why not Tuja? So to understand this, I have another video where I have made in this playlist you can get. Okay. The name of that video is Psychosis, Approach in Psychosis. There I have talked about, I have shown a case where I have actually discussed and tried to explain the way Burnette used to think in dealing with psychosis. Psychotic diseases. I tell you, my friends, psychotic diseases are a real challenge for us because they are rampant. I feel personally that reading the literature and seeing patients, 70 to 80% of the patients who come to us nowadays have psychotic backgrounds in and out. Full-blown psychotic or mixed psychosis is there. And psychotic diseases, psychotic illnesses are such that it does not annihilate very quickly. It takes time. It takes time. You have to have a lot of patience. So I will not talk about why Sabina instead of Tuja. Please go and watch my video on psychosis. It's an amazing video, very nice case I have narrated, and that will give you a lot of idea about how you deal with psychosis. So I'm here, done with it, and it was lovely talking to you. If any questions you can put in the comments, and please read all classical old books, go through it, and let's help the suffering humanity in much better fashion because we have got, homeopathy is a great science, great science. The only thing is we have to learn, we have to put ourselves into it and see that we can do much. In fact, I feel that we can do much better than our seniors because we can learn from them. We are well equipped. We have got a lot of other very good support system nowadays. So why we should be behind? Let's go ahead and help the society, the suffering, and take homeopathy to a next level. Thank you very much.